when I'm the treating physician and the patient with lymphoma is in front of me, which one do I get to choose for that patient? And so there may be two things. Number one, the insurance company may decide, we have a better contract with one of the companies and that's what you're going to give your patient. But if they really give me a free choice to decide, then I have to look at the data and try and balance efficacy and safety. And if you look at the data so far that we have for both the KITE studies and the Novartis trials, again, you cannot compare these studies side by side because obviously they weren't done as randomized trials. But if at least you want to try and get a feel for how they compare to each other, they look kind of similar. There are obviously differences, and we know there are differences in the vector, with the 4-1BB being used in the Novartis vector and CD28 being used in the KITE vector. And so there are going to be some differences in how these cells behave. But globally, I would say that the overall response rates look similar and the safety signal looks relatively the same, maybe with some nuances. And then what appears to be the case with the Juno data in the Transcend trial is that one may be a little bit different. And so there's some differences. Both the KITE and the Novartis product take all the T cells and infuse those. Whereas what Juno has done differently, and this is based on work done in Seattle, is that they separate the CD4s and the CD8 T cells, and then they basically activate those cells separately and then bring them together for the final product. And so that's what we call a defined composition product. And they're also using a 4-1BB similar to the Novartis product. And their early data suggests that they may have a better safety profile, that they're seeing less of the cytokine release syndrome, which is one of the main complications. And in some very early data with a small number of patients, the response rates that they're reporting are higher than the other two studies. And I think we're going to have to look at that data very carefully to make sure that this is not just a selection of better patients, because obviously with very small numbers and we haven't seen the full data set, there may be some patient selection there. But at least the first impression that I'm getting, based on what I know so far, is that there may be a slight advantage there.